factor number one that would have an effect on our blood sugar levels? Food, obviously. And when we mention blood sugar levels, obviously we're going to start talking about carbohydrates, because it is the macronutrient that has the biggest impact on our blood sugar, because carbohydrates does get broken down into sugar, into glucose. So, what do you need to understand from this is carbohydrates, as I mentioned in the previous video, does get broken down into glucose. If it wasn't for our insulin that we inject, if you have type 1 diabetes, it would remain in our bloodstream. So what you need to do is you need to understand how much insulin you need to inject. You also need to understand how much carbohydrates are you consuming. So I call these two insulin to carb ratio and carbohydrates counting. We need to master these skills. So people with type 1 diabetes, I swear they're probably better than any mathematicians right now because of that. Because automatically, all the time, we are kind of estimating the amount of food, calculating the amount of carbs, doing the insulin to carb ratio in our head, knowing something called our correction dose, so how much you need to drop your blood sugar by, how much insulin you need to do that. So, for the sake of this video, you guys need to know that carbohydrates is the only macronutrient that has a direct effect on our blood sugar levels. You consume a lot of carbs, your blood sugar is going to elevate unless you take insulin. You don't consume a lot of carbs and you take a lot of insulin, your blood sugar is going to drop. So we got to understand the different types carbohydrates are and the different effects different types will have. You get where I'm coming from? So, talking generically, I'm not going to put any scientific terms into this. There are two types of carbohydrates: simple carbs and complex carbs. Simple carbs are the fast digested carbs. You can call it the carbohydrates that obviously got the high glycemic index that would break down quickly in the body. Our body is able to break it down and digest it so quick. Complex carbs are the exact opposite, slowly digested. People always think that complex carbs are the allies and simple are the enemies. In most cases, yes, but not in our case. Not in our case as people with type 1 diabetes, because we need to know something. It's always better to prevent a hypoglycemia than treating it. So my slogan, you're going to read that everywhere, wherever I post: prevent, not treat. Why am I saying this? Is people try to avoid simple carbs. So examples of simple carbs, by the way: sugar, honey, fruit juices, sugary fizzy drinks, candy, donuts, cookies, chocolates, cakes, all this kind of stuff. Obviously, you're not going to find any nutritionist or a trainer putting them in a diet, but it's important for us to have it on the side because you don't want to risk going hypoglycemic. You just always want to prevent it, and you're not going to prevent a hypoglycemia using complex carbs. I'm going to tell you why after explaining complex carbs. Now, on the other hand, complex carbs, as I said, they are slowly digested, slowly broken down, like oats, anything that contains fibers, a lot of fibers, brown rice, brown bread, potatoes, and so on. What's the difference in terms of health, or what does it do in the body, putting diabetes aside? Complex carbs provides the body with constant energy. Because if you think about it, I'm going to try to draw a graph on this video if I can. If not, just watch my fingers. If you consume something that gets broken down slowly, so it takes hours to get broken down in the body, the energy curve is going to be like a bit, kind of linear and straight, and then it's going to drop slowly. So this curve is providing our body with energy, constant energy throughout the day. Now, if you consume simple carbs, instead of going through a tiny, nice curve, is gonna be like, like a peak. What does that do in terms of energy? You're gonna have a lot of energy for that period of time, and then you're gonna have like a sugar crash. Or you're gonna feel the energy is gonna be either consumed or stored. So after that, there's no energy in the body, you're gonna be lethargic. So in terms of nutrition and sports health, diet plans, training, all these kind of stuff, no one will ever put a simple carb. They will always prefer that kind of curve. Now, it's also good for our blood sugar levels because there is something a lot of people with type 1 know. It's called a sugar spike. So the same energy spike that I'm talking about, there will be a sugar spike following the exact same curve. Because what is sugar? What is food anyway? Food is energy. Food gets broken down into calories. So 1 gram of carbs, which is glucose, which is sugar, call it what you call it, has got 4 calories. So, and just for the sake of it, protein has got 4 and fat's got 9. So if you're gonna consume that carb, it's gonna provide your body with energy. So sugar spike, energy spike, they are both the same, and then it's gonna drop again. You might feel lethargic. When can you use simple carbs? If you don't have diabetes, you use simple carbs during or just before or just after a workout, because your body then can make good use of that energy curve or that sugar spike. When can you use it? Be having diabetes, same as someone without diabetes, but also to prevent or to treat a hyper. So, what do you get out of this video? You know both types, and you know that both types are important for us. But also, you gotta know your insulin to carb ratio, and you gotta know how to count your carbohydrates. So, what I'm gonna be doing, I'm gonna do 2 separate videos talking about these 2. And I was gonna mention the effect of fats and protein on our blood sugar levels, but I won't be able to do it in this video because it's long enough now. So yeah, I'm gonna do it in a different video.